welcome to It Takes Guts. I'm your host, Stacy. I've been a GI nurse practitioner for the past 6 years, and prior to that, I worked in the endoscopy department for 15 years. I love GI. Today, we're going to be talking about diarrhea. Diarrhea affects every person in the world at some point of their life. They even write little kid songs about it. You know, when you're sliding into home and your pants are full of foam, diarrhea. I mean, it's something that people make jokes about, but it's really uncomfortable. Nobody likes having diarrhea. So what could be some of the causes? Well, there's a number of them. An acute viral or bacterial infection can be a cause of diarrhea. Food sensitivities can be a cause. Irritable bowel syndrome, malabsorption, pancreatic insufficiency, or something like an inflammatory bowel disease such as Crohn's or ulcerative colitis. So how do you know what might be causing your diarrhea? So if you normally poop, once a day, looks pretty normal, nice and formed, or every other day, or maybe you err on the side of constipation, and suddenly, boom, you are having crazy watery stools, maybe some abdominal cramping with it, some nausea, even a fever. Most likely, you have an acute virus or bacterial infection that you've picked up. Viruses run their course. Most people feel better within 24 to 48 hours. You might feel a little for a few days or even up to a couple weeks after, but the acute diarrhea subsides. You're okay. Bacterial infections sometimes are a little more significant. You can get a fever with this. Sometimes you'll have a little bloody diarrhea. Abdominal pain can persist. If you are having diarrhea that came on suddenly, it's lasting for longer than 3 to 4 days, or if you're seeing blood in there, fever, go ahead and contact your GI provider or your primary provider because you might need to get a stool test to find out what type of bacteria it is so they can get you on the right antibiotics for that. If you have started noticing, I get loose stools sometimes right when I wake up in the morning. Normally it's okay, but every once in a while, crazy diarrhea, or you ate out at a restaurant and you barely got home. That might be a food sensitivity. You can develop a food intolerance or sensitivity at any point in your life. I've had people who were 80 years old who never had a problem, and suddenly they couldn't tolerate dairy or lactose. That actually is one of the most common causes of diarrhea, is a sensitivity to dairy products. There are other foods that can definitely cause diarrhea, and it's not necessarily an allergy to the food. It's just the way your body handles it, and it doesn't tolerate it well. Some people will go see an allergist for testing. It's really hard to diagnose true food and food sensitivities. An allergy, yes, like a tree nut allergy, that's pretty straightforward to diagnose. But if it's a food sensitivity and it's kind of vague, diarrhea after I eat out certain things, your best way to find out what you're sensitive to is to figure it out on your own, keeping track of what you're eating. For instance, if you ate a huge pizza, or maybe not even a huge pizza, maybe you ate 2 slices of pizza and you noticed a couple hours later your stomach's hurting, you have diarrhea. It could be the cheese on it. So maybe cut out dairy for a week and see how you do. If it's not dairy, maybe it was the oils in it. Maybe it was something really greasy. So you can kind of figure that one out on your own for the most part. Again, if you're like, I can't figure out what is triggering my diarrhea, anytime I eat, I get it. You definitely want to go see a GI provider or your primary care provider to get some more workup done. Malabsorption. Mainly malabsorption is going to be something from celiac disease or a gluten allergy. You would normally see this with diarrhea after eating or just chronic diarrhea. You can have weight loss with it, sometimes abdominal bloating. With this, it's not something normally that just starts out of nowhere. This is something probably that has gone on since at least childhood, maybe just didn't really see a correlation. So that's something that can be tested with a blood test or an upper endoscopy where they take biopsies of the small intestine. And that would be important if you're having chronic diarrhea, weight loss. You want to see somebody about that, find out what's going on. Other people can have malabsorption for other reasons, such as short bowel syndrome if they've had a major surgery. That's much, much more rare. Pancreatic insufficiency. I've seen commercials for, do you have EPI? So that's Exocrine pancreatic insufficiency. Again, this is pretty significant diarrhea. Very watery stools, very frequent. Some people get bloating or abdominal cramping with it, but it's because your pancreas doesn't secrete enough enzymes to help break down the fats. So that's something that is tested for with a stool study. And to treat it, we give you pancreatic enzymes in a little capsule form that you take with your meals, and it really helps. It stops the diarrhea. If you've had diarrhea on and off for your whole life, as far as you can remember, but it's not a daily occurrence, but at least 3 days a week, or if you've had diarrhea for at least 3 days a week for at least 3 months, not consistent, not always, every day, but usually you get bloating or abdominal pain or something with it. And then another day you'll have a normal bowel movement. That's more consistent with irritable bowel syndrome. And that's something that it can be a little bit of a booger to try to manage. There are different ways that we can help treat irritable bowel, but you want to see a provider to really get a diagnosis. You don't want it to be something different that you're ignoring. You want to make sure you're getting the right foods in your diet, or find out, oh, maybe that food is my trigger. Not that it's an allergy or sensitivity, but there are just some foods that tend to trigger diarrhea or are difficult for people with irritable bowel. Just the way their bacteria break stuff down, it causes symptoms. So if you're finding that, at least 3 to 6 months I have diarrhea, at least 3 days a week, usually with some abdominal pain, bloating, but it's not, the worst thing in the world. Still, you want to get that checked out. Some people can have it bad enough that they have a hard time leaving the house. And again, you want to see somebody to find out what's going on. Inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, is the other major cause of diarrhea. This is something that usually will start in childhood, teenage years, early adulthood. Sometimes we see it later in life. This is not normally just, I just get diarrhea. This is usually, it can be bloody diarrhea, a lot of abdominal pain, some malabsorption of vitamins and minerals. Sometimes people see mucus in their diarrhea. These people are pretty sick. They're not feeling good. And if the way you diagnose it is with colonoscopy, blood work, sometimes CAT scans, and then we give you medication that you need to take for life to help manage this. So those are some of the main causes of diarrhea. I'm sure there are many others, but we're not going to go through all 5,002 possible causes, but these are the main ones. So when would you want to go see somebody? I kind of touched on it, but just to recap, if you are having acute diarrhea with abdominal pain, fever that's lasting for longer than 3 or 4 days, go see somebody. If you're having chronic diarrhea that's happening almost every day, bloody diarrhea, mucus in your stool, abdominal pain, please go see somebody. If you're having weight loss with this, or you're just like, I can't figure out what's causing my diarrhea, it's just not getting under control, go see somebody. If you ate at Taco Bell and you suddenly had diarrhea, but the rest of the time you don't really need to go see anybody. You just might want to alter your eating habits. So those are really some of the major topics for diarrhea to touch on. We're going to go into some more detail on some of these individually later on in some other videos. So please like and subscribe to the channel. If you have comments or questions or some other things you want to hear about, please let me know. And remember, I want you to be informed, educated, and remember that you're not alone.